So, welcome back to another episode of the Let's Chat Derbyshire podcast, a podcast where we talk about mental health, suicide prevention and neurodiversity. Today we're lucky enough to be joined by Ellie, our Director of Public Health, and we're going to be talking a bit about leadership and looking after your mental health. So Ellie, just to get us started, if you wouldn't mind, just a bit of introduction of who you are, a bit about your role I guess, and what does the Director of Public Health do really?
So I'm Ellie Holston, I am the Director of Public Health for Derbyshire, and I've been in my post for about a year and a half now, and before that I was a consultant in public health in Derbyshire. I manage a team of people who deliver public health activities across Derbyshire. That covers health improvement, health protection and healthcare public health, so works with lots of different partners. It includes lots of services that people use across the county, so health visiting is commissioned by public health, sexual health services, drug and alcohol treatment services. We've got our Live Life Better Derbyshire team that support people with stopping smoking, weight management, those kind of things, and lots of other things that I'll no doubt get into trouble for trying to list and forget. But big team.
That's great. It is, I was going to say, when I've spoken to people from other public health departments, just in general, their teams are a lot smaller than ours. So I guess for context, there's about 360 just in our, in a team, isn't there? And there's everyone else that we work with.
So we do quite a lot of in-house delivery in Derbyshire. So some of the public health teams, they commission the services, so they buy them from other organisations, but we actually deliver some services ourselves within the council, which is why we've got a bigger team than some other public health departments.
And it's nice for having a big team, a lot of people to rely on. And then, the best team though, mental health suicide prevention team, obviously. So we'll just get that out there to start with. Having having to look after so many people in your role as Director of Public Health, but then also the responsibility of making sure residents, visitors and stuff are looked after with a public health way. How does it weigh on you? I can imagine there's a lot of pressure, a lot of meetings, a lot of big decisions to make. How do you sort of look after your own well-being to make sure you can fulfil the job as best as you can?
So there's definitely a lot of meetings, that's definitely true. And I guess quite a lot of decisions. It's definitely a team effort. So one of the things is having a really good team of people, and I've definitely got that in Derbyshire. We've got some fantastic colleagues that work across public health, and that certainly helps with the responsibility and the challenge, I guess, of managing all of those different services. I think there's always a level of personal responsibility that you feel whatever job you're in. I think you can feel that in a range of different roles, can't you? I think it's certainly not unique to leadership roles to feel the sense of responsibility for either other people or your colleagues, your team. So I definitely feel that, and it can be challenging. We've just as a council gone through some challenging times that have been sort of covered in the media around having financial challenges, which is something that lots of councils and lots of other public sector organisations are going through, and I think that can be a challenge for staff, for teams. So we've got to think about how we support people through those times. So it can be a challenge. I think for me personally, then I'm not brilliant at looking after my own mental health and well-being. I think a lot of us do kind of have those blurred boundaries often between work and home, and work quite long hours, and feel that sense of responsibility that means that you don't quite know when to stop, or because the work never stops, so there's always more to be done, isn't there? And I think that can be challenging. But for me, I guess one of the things I love is walking my dog. So I've been on Twitter, as it was, X as it is now, for a while. So anyone who follows me on there would know that I've got a Labrador that I adore, and I walk with her, and I particularly like to go on my own actually. I live in the Peak District, so I'm really lucky I can get out and walk, and that's great for my mental health. I wasn't sporty at school. I was always the one who tried to get out of PE. Now I advocate everybody should be physically active, but I've recently taken up kickboxing because my youngest son wanted to go kickboxing, and so I was driving him there, sitting in the car waiting for him and not doing anything, and I thought I may as well do this. And actually I've really caught the bug for that. I really enjoy it, so that's really been a good thing as well, because I think that just doing that exercise helps you to get some frustration out, and also you release those feel good endorphins, don't you, when you do exercise, that becomes quite addictive. If I don't do it now, I find I really miss it. And then I guess the other thing I do, which I do with you on a regular basis, is volunteering for Scouts. So I'm a Scout leader, and I think that's a really good thing for my mental health. I think volunteering generally is a really good thing, and it takes you away from your daily work and into something that you just have to think completely differently about, don't you? So you can't think about work when you've got 30 kids running around, so you really have to kind of give it all your attention, and also it's a great way of getting out and about, trying new things. I took up paddleboarding after trying paddleboarding at Scouts. So and you meet new people there, don't you? I've made a really good network of friends there as well, and those social contacts, really, that's also a really positive thing. So all of those things together, I think, are the things that help me. No,
that's great, isn't it? I think volunteering is such a good addition, I think, to the rest of them as well, because taking your dog out for a walk and stuff is really good to just balance yourself, I think, especially if it's getting too much, just to go out, come back. But being able to volunteer, meet new people, it's helped me just in my job in general, I think, being able to communicate better, and that sense of responsibility, like you said, having 30 other people's children running around or going camping, and then doing those activities that are a bit risky sometimes. It's great to do that. When it does get too much, I will cover some in a bit, but are there any signs that you notice in yourself that you're just like, right, I need to take a moment now, just it's getting to that point where I'm like, oh.
Yeah, so I guess if you ask my husband, he'd say that I get grumpy. He would definitely say that. So I think I can tell when I get a little bit short-tempered at home, and a little bit kind of less tolerant of things, and perhaps a little bit more likely to make snap decisions as well. That kind of actually just this, I just want to get through this, and I think you kind of feel like you're on a bit of a treadmill sometimes, don't you? So they're little signs for me that I can that I need to have a break. And I think also it's hard sometimes, particularly now with hybrid working, to find that kind of balance between work and home, because when your desk, your work is at home, your computer's there, your emails are there, it's hard to know when to stop. And so sometimes if I find myself sitting there at 10:30 at night, then I know I really have to have a word with myself, say this is not good for you. And also I am very conscious that we can spend a lot of time, although public health is full of people doing lots of great things, and there's lots of active stuff happening. Often in these sorts of roles, you end up sitting behind a computer for quite long periods of time, and you can find yourself sitting for a long time. So I start to get aches and pains, and think, actually, I really need to move more. I need to get out and move. So I think there are those signs where you can sort of tell it's starting to impact a bit on your health, and you need to sort of step back and take some action.
Like I said, there is always something to do, I think, in public health. It's not we don't really have down periods, I don't think, especially not now. There's so much going off, isn't there, that we need to be reactive to. So I think, when you sit there, time just flies by, and even little things like just making sure to stay hydrated. I think that's my thing. Is there's so many times I'm like, I've not drunk today at all, and then you feel so ill, don't you? And so that's, I think, my main sign is that.
I think there's that well-known sort of analogy about when you get on an aeroplane and they do the bit at the beginning where they talk about the fire exits and all of that, and they always say, put the oxygen mask of your children on first, or of others on first. And actually, if you don't look after yourself, you can't look after other people. No. So it is really important to make sure that you do those things, that that you can eat properly and get get a drink and do all of those things. And I'm also rubbish at drinking water. I've brought a bottle of water into work with me today, a big bottle, and I haven't had one sip out of it. I've carried it around with me all day. I have had coffee, which is not as good, but
no, at least it's something though. Yeah, I think it's that leading by example sometimes, especially people in leadership roles. If others can see you doing that, like taking a responsible breaks, going out, taking a walk or whatever, it encourages them to do the same. And it's nice when you see people in leadership roles doing that, because it makes you feel like, well, actually I should be doing that as well.
And I think also it's I don't know, maybe it's not helpful, but I've just done it, but it's to admit that, you know, sometimes we don't do that. So we might look, you know, we might try really hard to role model things, but as I've just said, I've completely failed to drink any water today, and that might not be a big deal, but you know, we're all human, aren't we? We all struggle with these things all the time. So so creating that bit of space to be able to just take a bit of care of yourself is really important. And there's really good evidence, isn't there, around sitting, as I said, for long periods being something that's really not good for your health, and just moving every 20 minutes if you can, just standing up and just having a quick walk around or doing something, just breaking those periods of sitting is a really helpful thing to do. And I haven't yet mastered the role modelling of that in terms of some of the length of meetings that we have, and I think actually we should really make time to just at least have a short comfort break or activity break so that people can stand up and stretch their legs, because it's important. Yeah,
it is always nice when you go in a meeting and there's a scheduled break, even if it is online, just 5 minutes, go and stand up, get a drink or something, because some meetings are hours on end, and like you said, you don't move, your eyes are straining, and it is horrible, isn't it?
It is.
I will load this up. Right. So as we've been talking about some signs to notice, I've written some down, so I will cover them. But from when we've been speaking to other people, some signs they've noticed: withdrawing from social situations, being able to trouble sleep, but then when sure sleep, trouble waking up as well. Avoiding going to the office, because some people I think must find it easy to just not engage as much. Being really forgetful, that's my tell, 100%. You just forget everything, don't you? Being more irritable, like you've spoken about. Consuming alcohol, I think that can be a big one, especially when it gets stressful. Drinking more, maybe you may be a social smoker, may turn to full smoking, vaping, whichever one it may be. And then the physical symptoms, headaches, eyes aching and stuff. I think we all notice them, don't we? But it's important, like you said, just to take that moment to reflect on it and think, well, even if I've not been getting it right, what can I do to slowly get it right? No one's going to be perfect, are they? I don't think you'll be able to ever achieve all of it. But by trying to acknowledge it, hopefully it'll help. And I think it's okay to pull people up on it. Like if I've been on my laptop ages, sometimes my manager will message me and be like, you've been online for a long time, like what, have you had your lunch or whatever? And it's just those little reminders, I think, sometimes that it's all right in it to go and get a brew and stuff.
It's a bit of a myth as well, isn't it? That, but it's one that we've all, I'm sure, fallen for around kind of the stress relief being having a drink, or if you smoke, having, that cigarettes somehow help you to
feel better,
relax, and it's actually the opposite is true, isn't it? So it's finding the things that really do work, and often that is getting outside, getting out for a walk, stretching your legs, doing those sorts of things, and recognising that some of those things that can be associated with stress relief actually do the opposite and can make things worse.
Yeah, definitely. Alcohol can impact your mental health massively in terms of feeling more anxious, more depressed. You said you've been in the role for about a year and a half. Mm-hmm. Last year we were really lucky. Your first Director of Public Health's annual Public Health Report. We spoke a lot about, you spoke a lot about it, around mental health being a priority. I was just wondering if you wouldn't mind giving us a bit of an update of your, priorities in mental health, what you want to achieve, and where we're sort of at with it.
So mental health is something that is really important to me, but also to the whole team and to people in Derbyshire, and it's been something that I've prioritised in my career for a very long time. So I think I was one of the first people to do the mental health first aid training back in Sheffield I don't know, it's probably about 20 years ago. I don't really want to admit how long ago it was, but when it was first developed, and I have done it here since, so I've refreshed the training for myself since, And things have got more difficult, I think, over time for lots of communities, lots of individuals around mental health. And so when I was thinking about what I wanted to do for my first Director of Public Health annual report, which I have to produce a report each year, and so each year we think about what do we want to focus on. And I chose mental health because I think particularly coming out of the pandemic, there's been so many challenges for people who've struggled with the experience of the pandemic, the cost of living pressures that have followed the pandemic, and how that's kind of led to an explosion really of people struggling with their mental health. I really wanted to kind of focus on that, and obviously we've been doing lots of work in Derbyshire around mental health and wellbeing, and we'd got the Let's Chat benches, which I think you're sat on.
I'm attempting to sit on one, yeah.
A Let's Chat bench, but we'd had the Let's Chat campaign, which was about getting people talking.
Yeah.
And I just really wanted to focus on that kind of whole system approach to mental health. And when I say that, I think what I mean is we often think about mental health in a very narrow way, and we think about it as either something you can, I'm paraphrasing here, but to talk people out of, or medicate people out of, or help them to cope with, in those two ways. And therefore it's an individual problem, and it's something about that individual that means that we need to talk them out, and we need to talk to them about it, or we need to give them medication. But because there's been such a growth in the number of people struggling with their mental health, that really doesn't suggest that it's about individuals. It really suggests that it's about the environment and the conditions in which we're living that are creating real stresses that are leading to a larger number of people struggling to cope for a range of reasons. So it's very much about the conditions in which we live. And when we think about young people, for example, you'll be familiar with all of those things that we talk about when we talk about young people's mental health, but the kind of growth of social media and the pressure that puts on young people, the move away from kind of coursework and exam mixes in GCSEs to a very exam-focused education system that means that all that pressure is at the end of that period of time, and those sorts of conditions and in the way that people are living start to cause more and more people to struggle, and so I'm really interested in looking at what are the conditions that are leading to that. What are the things that we can change that will help people to be well, mentally well, and to cope, and to develop sort of their own resilience and to live happy lives and all of that. So I think that was what I was really interested in, not just that kind of very narrow way that we've often looked at mental health. So the report does talk about mental health across Derbyshire. There's lots of information in there about different aspects of mental health and suicide prevention, and it really talks about that kind of everybody taking responsibility and building up that kind of let's chat, let's talk, let's listen approach, where we're encouraging a much more of a conversation about mental health and supporting people. So that's what the report focuses on.
I think it's really important. Mental health is everyone's responsibility, and when we say that, it's not like you said, it's not trying to paraphrase it and stuff, it's just embedding it in what you do. So by providing flexible working, or by taking up some mental health training, just so you are equipped with more skills, you're making it your business. By supporting employees, supporting friends, family, you don't have to have the answers, you don't have to be able to solve it, but by knowing where to support those people, whether it's like you said, just by doing physical activity helps your mental health. So just by encouraging someone to do that, go for a walk in the lunch break and stuff, you're helping to support that bigger picture. And like we look at the wider determinants of public health, it is the same for mental health, isn't it? Housing, drugs, alcohol, smoking, all there's so much cost of living, the financial implications of that. The more we can slowly address those, will have a knock-on effect, won't it? And especially with the cost of living now, if we can just try and help people get better access to food, better transport and stuff, it will have such a big impact on their lives.
Yeah, absolutely. All of those conditions really impact on people's mental well-being, don't they? So you know, and it's been known for a long time. I remember back in, you know, maybe the early 2000s doing work in Sheffield around debt advice and mental health with IAPT, which is the talking therapies in the NHS. And we put those two services together because it's really clear that there's a strong link between people who have financial hardship and debt and mental health. And there's research that shows that it's a two-way relationship. So being in debt can cause mental health issues, and having mental health issues can lead to debt. So the two things you know, work together, and so treating them together or supporting people to find ways through those things together is really important. And I think we, again, when we talk about mental health, we do often talk about it as that kind of individual thing, and yet all of these things that so many of us experience, whether it be difficulties at school, whether it be the cost of living, as you say, the kind of the pressures of caring, for example. So there's lots of people who are looking after relatives or children, or you know, that are, and particularly sandwich carers who get stuck in between kind of get to a certain age, you've got aging parents, you've got younger children, you're kind of stuck in between those two sets of responsibilities. All of that pressure can create situations where people struggle with anxiety, depression, a whole range of issues, and trying to provide that social support and tackling some of those wider issues I think is really important to think about when we think about how we create better conditions for mental well-being. No,
it's great. And I think, like you said about the, you know, services connecting up, the more, you know, us as a team try and reach out and support other services to be able to have that understanding, it will have a knock-on effect. And I think in Derbyshire we are quite good at working together. It's not perfect, nowhere is it? But in terms of the services we work with, we've got that good reach, and I think it talks about it in the report a bit.
I think these problems that we are trying to tackle, so poor mental well-being and the kind of the increase in that, and there's a whole range of problems. They're really complex issues. There's so many things that play into them that there's just no way that one service or one team or one part of the system can solve them by themselves. So it's absolutely vital that we all work together to think through how are we going to make a difference and help, you know, to improve people's lives, because that's what it's all about at the end of the day.
Definitely. Lovely. Just before we round it up, are there any final words you'd like to say? For anyone who is interested in reading the report, we will put a link to it in, because, you know, it just shouts about the work we've done, to be fair. So nothing bad about that, is there? But there is some other interesting bits in there as well, that, you know, a link those sort of wider factors to mental health that people may be interested in. Is there any, I guess, final comments?
Just, I think that so this podcast is something that we've started to do in Derbyshire, and it's all credit to you, Luke, for putting it together. And I think it's really interesting to use these sort of, I say newfangled because I sound really old-fashioned, but you know what I mean.
Yes.
So these kind of, you know, different ways of reaching people and to get messages out there. And I think we're really trying to do that in Derbyshire through the podcast, through some of our social media activities, trying to use some of those ways of communicating. And I think that's really important, because we need to reach a wide audience around awareness raising and these issues. So I'd like to commend the work that you've done in with this and with Let's Chat. I mean, Let's Chat, you know, you can't go anywhere in Derbyshire without seeing Let's Chat on a bench somewhere, and I'm always amazed at wherever I spot it. I think, gosh, it's even here.
No, it's reached far, hasn't it?
So I think that's a really positive thing, and we need to do more of that, and the podcast is a great way of hearing, so perhaps not from me so much, but, you know, from a wide range of voices in Derbyshire, people who've experienced bereavement by suicide. You've had people with different neurodiversity, you know, challenges, talking about their experiences, and I think that's just a really good way of letting people know that they're not alone and that those experiences are shared, and I think that's a really positive thing. So I'm really pleased to have been able to come and talk to you today.
No, it's been nice, and I think it's good, you know, you've been able to be so open and share your own challenges and, you know, bits where you may not be doing too good, because then hopefully it'll inspire other leaders, other managers and stuff to be able to step up and, you know, support themselves to then be able to support the staff and, you know, a bit better. So yeah, thank you. It's been great. So let's round it up. So thank you all for listening. It's been great. Like I said, we're going to add an attachment to the Director of Public Health report in there. We'll probably put another link in as well to some more of the Let's Chat stuff, as well as all the digital stuff we do. We do have free resources you can order as well. So if you do want to sum up for your community, do get them ordered. Just a reminder, if you're not already, do follow us though on Facebook, Instagram, Twitter. As we post on there constantly, so there's some really good content that you can share to help, you know, make mental health everyone's business. And don't forget to like and subscribe. If you are listening to this on Spotify, do give us a review, because then it will get shared to other people in Derbyshire so they can also listen to it. So yeah, thank you.
Thank you.
Woo!